What does it mean for you to be burned out at work, and how can it affect your health? I'm Dr. David Geyer, orthopedic surgeon, and I want to help you feel and perform your best, regardless of age, regardless of injuries, and yes, workplace burnout. Burnout is actually now a legitimate medical syndrome. The World Health Organization just listed it in what's called the IDC-11 that'll come out soon, their classification of diseases. It's a legitimate medical syndrome, so that means, unfortunately, it's a real problem. This isn't just, oh, I'm not feeling good at work one day. This is a real issue. They call it basically chronic stress that's not been successfully managed, chronic stress at your workplace. And it has really three categories of symptoms: energy depletion and emotional exhaustion, increased distance or feelings of distance from your work or negative feelings about your work, and decreased work performance or work productivity. So in simpler terms, exhaustion, cynicism, and feelings of ineffectiveness. Now, one of the challenges with workplace burnout, and this is across spectrums, in another video we're going to talk about how common workplace burnout is, but across industries, whether it's medicine, whether it's the corporate world, or any other workplace environment, people don't want to get help. They don't want to ask for help. They don't want to be seen as weak. So they're feeling all this stress from doing all this and all the other causes that lead to workplace burnout. But rather than asking for help and potentially being seen as weak because maybe they need a break, which I would argue is not true, they respond by working harder, leading to more and more stress, and that builds up over time and can lead to a lot of negative symptoms. So as you're watching this, just think about some of these symptoms of burnout and ask yourself if some of these apply to you. Chronic fatigue, frequent irritability, difficulty sleeping, brain fog, forgetfulness, depression, anxiety, dreading going to work some days, rolling your eyes when customers or patients or your coworkers complain to you, mentally checking out in meetings, spreading negativity in the workplace, wondering why you started working at this job or in this career in the first place, and dreaming of retiring in a few years, let alone wondering how you're going to work 20 or 30 more years. And all these symptoms and all the stress that results and some of the loneliness and isolation that you can feel because you don't want to get help and you don't want to talk about some of your feelings and some of your symptoms, that can lead to a lot of negative health effects as well. We know that weak social connections and loneliness are associated with a reduction in lifespan equivalent to smoking 15 cigarettes per day. It's associated with a greater reduction in lifespan than obesity. Loneliness is associated with cardiovascular disease, depression, dementia, anxiety. At work, loneliness reduces task performance. It impairs reasoning and decision making. And here's the problem: 63% of U.S. employees that face this chronic stress respond to it by engaging in unhealthy behaviors that lead to things like substance abuse. And we don't have numbers on this across the workflow, but there's a really scary statistic when it comes to my world, and that is physicians. About 400 physicians each year take their own lives. Doctors currently have the highest suicide rate of any profession in society. So we have to do a better job at recognizing burnout in the workplace and take steps to correct course immediately. In our next video, we're going to talk about how common burnout is and what some of the common causes are, so that as we move forward, when we talk about some of the ways to treat this and the ways to prevent it, we really know what we're up against and who to target, how to make our difference in the best way. If you like this video, click some of the videos below. I hope they help you, and I'll see you right here next time.